Good morning, everybody. I would like to thank scientific committee for DAR and especially Professor Mohammed Hassani. My talk is about blood glucose monitoring in Ramadan. How frequent should we check? I have not conflict of interest for this presentation. Monitoring during Ramadan, it depends for type of diabetes, for stratification scores, for type of medication, the means used in monitoring, pre-Ramadan assessment and education, and glucose excursion causing feeling of being unwell. What are the links between Ramadan fasting and monitoring of blood glucose? The first one is the risk during Ramadan. You know that hypoglycemia and hyperglycemia and also ketoacidosis is more important during Ramadan. The second one is that blood glucose monitoring, it's a key component of Ramadan-focused education. The third one, it's a component of the risk score. The education per Ramadan tells us that patient can break and must break their fasting if blood glucose is under 70 milligram per deciliter or more than 300 milligram per deciliter. And finally, the main concerns associated with any anti-diabetic treatment are glycemic control and the risk of hypoglycemia, also with sulfonylurea with insulin. The pre-Ramadan assessment is very important, and you know that the blood glucose monitoring is better. The better self-monitoring of glucose and treatment management is one of the key of pre-education in Ramadan. Now, how frequent should we check? It depends to many factors, like guidelines, risk scores, type of diabetes, patient profiles, and medication. Many individuals on diabetic agents have a long duration of diabetes, multiple comorbidities, and renal impairment. Hence, they are at higher risk of hypo when fasting during Ramadan. Individuals with type 2 diabetes on 3 or more anti-diabetic agents, especially insulin or sulfonylurea, who fast during Ramadan should receive counseling and comprehensive advice on diet, lifestyle, and drug dose modification period Ramadan. So, the monitoring, as soon as we are no longer in monotherapy, the self-monitoring blood glucose can be reinforced. The doses of some OADs and insulin need to be adjusted or even reduced, and new technologies that are increasingly integrated. When you look the risk scores, levels, and recommendation, if you are patient with moderate or low risk monitoring, it's once or twice a day. But when we have a high risk or individuals or insulin and or sulfonylurea, they may be choose to monitor their blood glucose level more frequently. The type 1 diabetes, it's a particularity and need more recurrence because there are factors including motivation, like motivation for self-monitoring blood glucose, the feasibility of and access to CGM monitoring and advising insulin delivery technology. In conclusion, the monitoring in type 1 diabetes is crucial. When to test? The patient who fasting are advised to self-monitoring using 7-point glucose monitoring methods. The moment it's in pre-dawn meal at suhoor, at morning, at midday, at mid-afternoon, pre-sunset meal, at iftar, 2 hours after iftar, and any time when there are symptoms of hypoglycemia or hyperglycemia. When you take the type 1 diabetics with depend to regimen, we have type of insulin regimen. When we have a patient with pump, they advise them to use CGM. When you have, we are diabetes, type 1 diabetes with basal bolus with analog or basal bolus with conventional insulin, you have 7-point glucose monitoring. And when you are patient with premix, analog or conventional, at least 2 or 3 daily reading and whenever any hypoglycemia symptom develop. Now, if you use basal insulin, you have to check essentially the blood glucose in fasting hours, at morning, midday, and before iftar, and adjustment of insulin concern the basal insulin. When you use the non-fasting hours at post-iftar, midnight, and pre-dawn, you have to check especially glycemic after use or before use short-acting insulin and adjust the doses with the glycemic control. What tools should we choose for the blood glucose monitoring? We have a progression of blood glucose monitoring and the current blood glucose monitoring now, it's self-monitoring blood glucose, continuous glucose monitoring, and flash glucose monitoring. It is documented that self-monitoring of blood glucose is of vital importance for patients with type 1 diabetes who fast, and the advantages of CGM, of FGM technique should be highlighted. Structured education with adjustment of those dose of glucose-lowering medication alongside use the FGM can effectively mitigate the increased risk of hypoglycemia in patients with type 2 diabetes on multiple glucose-lowering therapy. IDF-DAR guidelines recommended the use of CGM as the method of choice if available for patients with diabetes who observe Ramadan fasting. Studies have indicated that CGM and flash or intermittently scanned glucose monitoring provide the benefit of predicting hypoglycemia and accessing glycemic excursion during Ramadan fasting. This is a study, it's evaluating the impact of Ramadan fasting on ambulatory glucose profile among patients with type 1 diabetic. And compared to the pre-Ramadan data, we finding that no significant alteration were noted in terms of the low glucose event percentage of glucose level below 70 milligram per deciliter, the average duration of hypoglycemia events, and percentage of glucose level below 54 milligram per deciliter from the values observed during and post-Ramadan. For the period during and post-Ramadan, except scanning of freestyle liver during Ramadan month compared to the pre-Ramadan. In this study of Effendi, published in 2017, glycemic control in type 1 diabetes before Ramadan in adolescents appears to correlate with blood glucose profile during Ramadan fasting. It is very, very important for educational program before Ramadan. And this data suggests that optimal glycemic control before Ramadan may reduce the potential risks associated with fasting and minimize glucose fluctuation. If we look at the CGM among children and adolescents with type 1 diabetes before and during Ramadan, this figure tell us that there was not a difference before and during Ramadan in time in range and in other parameters in patient adolescent with type 1 diabetes. Now, what are the patient behavior? It is the essential problem during Ramadan. Uh, we have several categories. Those who self-monitoring of blood glucose is part of their routine, and who apply it regularly before Ramadan, and will continue to do so according to their doctor suggestions. Those who do not apply blood glucose monitoring and know that during Ramadan they will be more likely to deviate from their diet. Those who are limited by lack of means like insufficient sleeps. And finally, those who have not received sufficient education in pre-Ramadan. Now, you have finding with our study in Algerian conducted in 2019. And the principal result is that the self-monitoring blood glucose was down by about 686 patients. The practice of blood glucose monitoring decreased during Ramadan and was from the recommendation provided during the pre-Ramadan education. The frequency average of blood glucose monitoring before Ramadan was 3.5 versus 2.6 per day during Ramadan. However, we noticed that the post-iftar glycemia was less controlled by the patient to avoid knowing the rate glycemia. We compared this study with a new study with 1,647 patients, and the suggestion from the practitioner, it's very, very important, and are regarding the new guidelines. Look at the breakdown at the no fasting hours, and we have all practitioners give advantage and priority for fasting period. It's the majority suggest for a moment to check the blood glucose. We look at the patient and their check for blood glucose during Ramadan is the same. It's that advantage and priority is given for period fasting hours period at morning, midday, mid-afternoon, and pre-sunset meal. In conclusion, we need to promote therapeutic education before Ramadan and reinforce follow-up during Ramadan. We have seen from this conference that the number of blood glucose tests differs according to risk score, type of diabetes, and medication. Ensuring patient safety remains crucial, and it's vital to insist on continuous monitoring in type 1 diabetes. The ADA, EISD, and ADA 2024 recommendation partially indicate CGM and FGM in type 2 diabetes. To answer for the question, blood glucose monitoring in Ramadan, how frequent should we check? Ramadan seems to be a condition and an indication for this tool for better patient safety during Ramadan and to alleviate their burden. Thank you for your attention.